What would the repeal of Obamacare do to your business? And if and when they do repeal it, what would you like to see to replace it?
Well, I think, first of all, you have to say that the Congress will modify whether the president can just repeal the bill or not. And I think there are going to be a number of things that are going to limit the enthusiasm for Congress to do this. Certainly, the Affordable Care Act needs to be reformed. There's a lot of problems with it. But whether it needs to be completely replaced or not, I don't know. One of the things you have to consider, if it's completely repealed, that leaves 20 million people who currently have coverage without coverage. It also deprives Congress of a lot of income from taxes that have supported the Affordable Care Act. So I think that there will be some moderation in the thinking around the Affordable Care Act and repealing it instantly.
What are some of the other options, Mr. Cosgrove? Because what you mentioned and what might involve a budget reconciliation process could get a little tricky. So, but the reaction in the stocks is clear. They just see this as very bad news for some of these hospital operators. So what are some of the other possible outcomes here?
Well, I think the reason that they see it as bad news for the operators is if, in fact, what the Affordable Care Act has brought to us is more patients who have insurance coverage. We would still have the same number of patients, but we would not have the insurance coverage to go with them, and it'd be financially troubling to hospitals and providers of health care and, in fact, the entire healthcare industry.
You know, in order for Obamacare to work, everybody had to be participating to keep the premiums at an affordable rate. That didn't happen, clearly. Insurance companies left exchanges. Healthy patients did not subscribe, and premiums went up a lot in some cases. How do you modify that? I mean, if you're not expecting a total repeal, how do you modify it so that those people who ended up paying a much higher premium or faced it next year don't face it in the future?
Well, I think that's the real dilemma that we're left with. I think one of the things that you neglected was the fact that insurance companies underpriced what they thought that insurance was going to cost them, particularly because they thought once they captured these patients, they'd have them for the long term and could continue to raise the premiums. That also backfired on them because they had to raise the premiums substantially more.
Exactly. So what happens now? I mean, I guess if Hillary Clinton had won, right now we'd be talking about Medicare for everybody. We'd be talking about further moves towards the effectively kind of private, towards the nationalization of the healthcare system. Do you think all of that is off the table, or do you think that in some ways these are still kind of creating creeping new entitlements that will be with us for some time?
No, I don't think we're going to see creeping new entitlements. I think there's been multiple proposals. One of the things that has been proposed is health savings accounts and also allowing insurance companies to go across state lines and have block grants to states, all of which have the potential for decreasing the cost of health care, particularly block grants could limit what's going to be the increasing cost of health care, particularly in Medicaid. So there are a number of things that have been discussed. The plan is not fully formed, but I think you're going to see perhaps a shrinking or, if you will, an unraveling of the ACA, but probably not a complete repeal.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.